when you go in to negotiate, you can't even think about negotiating for a wage increase, because the whole negotiation is about trying to keep the benefits you already have. That's not just the fault of the employer. It's the fault of a broken health care system that's sucking up all the money. When are we going to stop it? When are we going to say enough is enough? How many more workers have to lose their coverage? How many more families have to go into the red for a sick loved one? How much longer are we going to have to wait? It can't wait.
The Republican Party now facing yet another full-court political press by health reform's most effective asset, President Obama speaking before big crowds. And so once again, Republicans are faced with the question, who should rebut the president? Do you put somebody up against him, or do you just do a press conference thing somewhere else? Do you actually have somebody else bookend the president's speech to look like they are the opposition to the president? On whom should they rely to counter probably the greatest public speaker of his generation? Well, so far, Republicans have proven that not all 0 for 2s are created equal. First, they chose Louisiana Governor Bobby Jindal for what came to be known as the Howdy Doody speech.
I'm Bobby Jindal, governor of Louisiana. Like the president's father, my own parents came to this country from a distant land. When they arrived in Baton Rouge, my mother was already 4.5 months pregnant. I was what folks in the insurance industry now call a pre-existing condition.
Next, Republicans tapped Louisiana Congressman Charles Bustani, a cardiac surgeon who seems a generally reasonable fellow, except for the awkward trail of court records showing him falling prey to con artists who scam gullible rich Americans into trying to buy English titles of nobility. That was awkward. That was 0 for 2. Today, the Republican Party searched around for another elected official who could give rebutting the president a try. They looked around and looked around and looked around and decided apparently they could not find one. So instead, they picked a Republican who is not an elected official anymore because he lost his re-election bid really badly 3 years ago. It's former Pennsylvania Senator Rick Santorum. He was asked by the Republican National Committee to pre-butt President Obama's address today to the AFL-CIO convention in Pittsburgh. Now, this marks a return to the national stage for this former senator. He used that national stage to say today that he might consider running for president himself in 2012. Senator Santorum's only real national name recognition outside the conservative movement until now has been because of his infamous Associated Press interview in 2003, in which he used the phrase man on dog when talking about same-sex marriage. That prompted the classic response from the Associated Press reporter who was interviewing him, a response that, as far as I know, has never been equaled in any news transcript ever. Quote, "I'm sorry, I didn't think I was going to talk about man on dog with a United States senator. It's sort of freaking me out," end quote. Well, now Senator Santorum is being welcomed back to the national stage as the Republican spokesman against the president on health reform. Game on. Joining us now is Pennsylvania Governor Ed Rendell, former chairman of the Democratic National Committee. Governor Rendell, thanks very much for making time to be on the show tonight. Good to see you.
Good evening, Rachel.
Senator Santorum was not who I expected to be chosen by the Republican Party to rebut the president today on health care. Do you think that his selection says anything about what the Republican Party's message is on health care right now?
Well, I think it says they basically have no message. When Rick Santorum was in the Senate, he voted against everything that was important to Pennsylvania to preserve or expand health care. We tried to work with him. We tried to persuade him that it was against the interest of Pennsylvanians, but he was always a no vote on expanding coverage in any way to children or to adults, number one. Number two, as you pointed out, he was defeated for re-election by almost 20 points, which in a state as evenly balanced as Pennsylvania is a stunning landslide. And number three, he's also very well known for one other thing, Rachel, that you didn't mention. The Republicans raised the specter of the government deciding who lives or dies, the so-called death panels. Well, Rick Santorum was the leading proponent of the government stepping in the Terry Schiavo case and passing legislation that would have taken the power to decide whether Terry Schiavo would live or die away from her family and giving it to the government, giving it to the Congress of the United States. So this is fraught with irony, and it shows just how bankrupt the Republican Party is when it comes to any cogent argument or any reasonable ideas of their own.
Do you think, when you think about the average Pennsylvania voters that you know and that you've campaigned with and alongside and for their votes over all these years and all the campaigns you've been involved in, when you imagine average Pennsylvanians looking at the health care debate right now, is there a sense that the Republicans' refusal to engage on policy is going to hurt them? They have brought a lot of heat to this fight. They have not really brought policy proposals to it. Does that hurt them ultimately?
I think it's beginning to. I think at the early stages, the heat was very effective. And I think it was effective, and you and I have discussed this before, because President Obama sort of laid back and didn't get in there and fill the vacuum and answer the questions. I thought he did a great job of that in his appearance before the joint session of Congress. And now the public's beginning to say, all right, well, if you're not for this, what is the answer? The status quo clearly doesn't work. And the president did a great job of explaining that. And as the Republicans failed to come up with any cogent response or plan, I think the tide is turning against them.
When you think about the health care needs of your state, the fiscal needs of your state, and obviously Pennsylvania has had nationally famous fiscal trouble this year in terms of dealing with your big budget crisis.
Right.
When you look at what you need in terms of health care reform at the national level, what's your bottom line? What is most important to you for a bill coming out of the Congress on health reform?
Cutting costs and increasing accessibility. You nailed it when you said people are losing their health care. In the last 7 years, 560,000 Pennsylvanians have lost employer-based health care. 10 years ago, you could get a family plan if you were an employer for your employee for $5,500. Today, it's $11,400. And by 2016, if we don't do anything about it, it'll be over $25,000. No one will be able to give health care to their employees. No one.
In the absence of price controls, how do you bring down health costs enough to make it affordable? Once again, do you need a public option?
I think a public option would be the surest way to do it, but you can do it by a co-op, you can do it by setting tough standards, and you can also do it by saving money. I gave an example. In Pennsylvania, we passed a very strong bill to control hospital-acquired infections, which were costing us in Pennsylvania $3.5 billion a year to the system. In 1 year, we cut that cost by 8%, saved $358 million in charges to all of the people who pay for health insurance. Just think, that's one state with one little aspect. We're not talking about controlling chronic care. The president is right that cost controls can bend back the curve and actually save us money so we don't increase the deficit, but take money off of the deficit. The problem is the CBO will not count anything they can't quantify. But we know from experience in state by state that we can reduce health care costs, and that can pay for a lot of this, what's going to cost us to have universal accessibility.
Ultimately, the prospects for reform may rest on whether or not the president's able to make a credible case that reform will work. It'll be more than just scary. It does have prospects for working, and so cases like that will be part of it, making that argument. Pennsylvania Governor Ed Rendell, it's always great to have you on the show. Thanks for being here.
Thanks, Rachel.